1 in 8 men will develop prostate cancer during their lifetime. Yet, most won't realize it until the condition has quietly progressed because the early signs are often subtle, misunderstood, or completely ignored. If you're over 50, or if someone in your family has faced this disease, what you're about to learn could be critical to your health and future. Prostate cancer doesn't always begin with sharp pain or visible symptoms. It often starts with quiet, persistent changes that most men dismiss as normal aging. But make no mistake, early detection can mean the difference between successful treatment and serious complications. In this video, we're going to walk you through 10 signs your body may already be showing. 2 of them, symptom number 7 and symptom number 10, are often completely overlooked, even by otherwise health-conscious men. Pay close attention. This isn't just health advice. It could be the knowledge that helps protect your life or the life of someone you love. Why prostate cancer deserves urgent awareness. In 2024 alone, over 300,000 men in the United States will be diagnosed with prostate cancer, and more than 30,000 won't survive it. That's not just a statistic, it's a clear warning. What makes this disease especially dangerous is its silence. In the early stages, there are often no symptoms at all. Many men feel fine until the cancer has already spread. Yet when caught early, prostate cancer is one of the most treatable cancers. That's why regular checkups, even without symptoms, are not optional, they're essential. Early detection isn't just helpful. It's life-saving. What is the prostate and how does cancer form? The prostate is a small, walnut-sized gland located just below the bladder. Its primary role is to produce seminal fluid, which nourishes and transports sperm. Most prostate cancers begin in the gland cells. These are called adenocarcinomas. While some of these cancers grow very slowly and may never cause harm, others are far more aggressive. The danger begins when abnormal cells start multiplying uncontrollably. Over time, they form a tumor. If left untreated, these cancerous cells can break away and spread to other parts of the body, a process known as metastasis. That's when the risk becomes life-threatening. The 10 early warning signs of prostate cancer. Symptom number 1, painful or burning urination. One of the earliest and most overlooked signs of prostate trouble is a burning sensation or pain while urinating. This symptom often arises when the prostate gland becomes enlarged, either from inflammation or the growth of cancer cells placing pressure on the urethra, the narrow tube that carries urine out of the body. This pressure can obstruct normal urine flow, leading to irritation and discomfort. In some cases, this blockage causes urine to remain in the bladder longer than it should, increasing the risk of infection. While urinary tract infections or other benign conditions can cause similar symptoms, persistent burning or painful urination, especially in men over 50, should never be ignored. It may be an early warning sign that the prostate is under stress or experiencing abnormal changes. If you experience this symptom more than once, it's critical to consult your healthcare provider for a full evaluation and the appropriate diagnostic tests. Symptom number 2, frequent nighttime urination. Waking up once at night to urinate may not raise concern, but when it happens multiple times, it could signal a deeper issue. Frequent nighttime urination, or nocturia, is a common early sign of prostate enlargement or cancer. As the prostate begins to grow, whether due to benign conditions or tumor development, it can press against the bladder or urethra, reducing urine flow and causing the sensation of incomplete emptying. This leads to repeated urges to urinate, especially during the night. Nocturia disrupts sleep, increases fatigue, and can quietly erode your quality of life. While many attribute it to aging or fluid intake, persistent or worsening episodes should prompt a medical evaluation. Tracking how often you get up at night can help your doctor assess whether your prostate is contributing to the problem. Don't dismiss this sign as minor. Nocturia may be your body's early signal that something more serious is developing in the prostate. Symptom number 3, blood in urine. Seeing blood in your urine or even detecting it through a lab test should never be ignored. This condition, known as hematuria, is a potential warning sign of advanced prostate cancer. As cancerous cells grow and spread, they can invade nearby structures like the bladder, urethra, or surrounding blood vessels, causing them to bleed. There are two types of hematuria: microscopic, where the blood is invisible to the naked eye and only detected through testing, and macroscopic, where the urine appears pink, red, or rust-colored. While blood in the urine can result from infections, kidney stones, or other conditions, its presence in men over 50 always warrants further investigation. Even a single episode of discolored urine should prompt a visit to your healthcare provider. With prostate cancer, early signs are often internal, and silent hematuria may be one of the few visible red flags. Timely testing could make all the difference in diagnosis and outcome. Symptom number 4: pain in the back, hips, or legs. Persistent pain in the lower back, hips, or upper legs may not seem unusual, especially with age. But when this pain lingers without clear cause, it could be far more serious than muscle strain or arthritis. In later stages, prostate cancer commonly spreads to the bones, particularly the spine and pelvic region. This spread, or metastasis, can cause deep, aching pain that worsens over time. It may be dull and constant or feel sharp and sudden, especially at night or during rest. Some men may also experience weakness, numbness, or tingling in the legs if the cancer presses on spinal nerves. These symptoms often go misdiagnosed or overlooked until the cancer has progressed. If you're experiencing unexplained pain in these areas, especially if it doesn't improve with rest or treatment, don't wait. A full evaluation, including imaging and lab tests, could detect prostate cancer before it becomes more difficult to treat. Symptom number 5: unexplained weight loss. If you're losing weight without trying no change in diet, no new exercise routine, your body could be signaling a deeper issue. Unexplained weight loss is often one of the earliest systemic signs of cancer, including prostate cancer. As cancer cells multiply, they demand more energy, disrupting the body's normal metabolic balance. This can lead to a breakdown of muscle and fat, loss of appetite, and even changes in taste and digestion. While many people initially view sudden weight loss as a positive change, in older men, it can be a red flag, especially when paired with fatigue or general weakness. Prostate cancer, when advanced, often causes these whole-body effects even before localized pain appears. If you've lost more than 5% of your body weight in a short period without trying, don't ignore it. Bring it to your doctor's attention. It could be the first step toward uncovering a hidden but treatable condition. Symptom number 6: pain in the rectum. Rectal pain is an often overlooked symptom that can signal the spread of prostate cancer beyond its original location. As the prostate gland sits directly in front of the rectum, an enlarging tumor can begin to press against or invade surrounding tissues, causing discomfort or a dull, persistent ache deep in the pelvic area. This pain may be mistaken for hemorrhoids, constipation, or other gastrointestinal issues. However, when it becomes chronic, especially when paired with urinary changes, it should raise concern. Men may also notice additional symptoms like gas pressure, bowel irregularities, or even difficulty with bowel movements. In more advanced cases, cancer cells can obstruct or irritate the rectum, leading to inflammation and even partial blockages. If you experience ongoing rectal discomfort that doesn't respond to typical treatments, don't delay seeking medical evaluation. Early imaging and prostate-specific tests can help determine whether this symptom is part of a more serious underlying issue. Symptom number 7: pain while sitting. If sitting for long periods, especially on firm surfaces, has become uncomfortable or painful, it could be more than just poor posture. In some cases, this specific discomfort may be an early sign of prostate cancer. As the prostate enlarges due to tumor growth or inflammation, it can exert pressure on the pelvic floor, nerves, and surrounding tissues. This pressure leads to aching, soreness, or a sense of fullness in the perineal area, the space between the scrotum and rectum. Unlike muscle or joint pain, this discomfort doesn't go away with stretching or movement and may intensify during prolonged sitting. Many men ignore this symptom, assuming it's age-related or due to sciatica, but persistent pain in this area warrants a closer look. If sitting becomes an ongoing source of pain, especially when paired with urinary or sexual changes, it's time to consult your doctor. This seemingly minor symptom could be an early clue to something more serious. Symptom number 8: difficulty urinating or weak stream. One of the most common early warning signs of prostate cancer is difficulty urinating. You may notice a hesitant start, a weak or interrupted stream, or the feeling that your bladder isn't completely empty even after you've just used the bathroom. This happens because an enlarging prostate, whether due to benign conditions or cancerous growth, can press against and narrow the urethra, the tube that carries urine out of the body. As the passage becomes restricted, the bladder must work harder to push urine through, leading to straining, discomfort, or the need to urinate again shortly after. While these symptoms are often attributed to benign prostatic hyperplasia, they can also be an early sign of something more serious, including prostate cancer. If these urinary issues become frequent or worsen over time, don't wait. A medical evaluation, including a prostate exam and PSA test, can help determine the true cause and guide appropriate treatment. Symptom number 9: loss of bladder control. Losing control over your bladder isn't just inconvenient, it could be a sign that something is seriously affecting the structures responsible for urinary function. In prostate cancer, especially when the tumor grows large or spreads beyond the gland, it can interfere with the nerves and muscles that regulate bladder control. This may result in sudden urges to urinate, dribbling, or even involuntary leakage. While incontinence is sometimes a side effect of prostate cancer treatments like surgery or radiation, it can also appear as a symptom in more advanced stages of the disease. Many men dismiss it as a normal part of aging or prostate enlargement, but recurring bladder control issues, especially when combined with other urinary symptoms, should be thoroughly investigated. Up to 1 in 4 men treated for prostate cancer may experience some level of incontinence. Early diagnosis and intervention can help manage the underlying cause and improve both function and quality of life. Symptom number 10: painful ejaculation. Pain during or after ejaculation is a symptom that many men hesitate to talk about, but it can be an early warning sign of prostate problems, including cancer. The prostate plays a vital role in producing seminal fluid, and when this gland becomes inflamed, enlarged, or invaded by tumor cells, the entire reproductive system can be affected. Men may experience sharp discomfort in the penis, a dull ache in the testicles, or a deep throbbing pain in the lower abdomen or rectal area. While this pain might be intermittent at first, it often becomes more frequent or intense over time. It's important to note that painful ejaculation can also be caused by infections or other non-cancerous conditions, but it should never be ignored, especially if it persists. If intimacy begins to feel painful instead of pleasurable, don't brush it off. Talk to your doctor. Early evaluation can lead to early treatment and better outcomes. What causes prostate cancer? While scientists still don't fully understand what causes prostate cancer, we do know how it begins and why it's so dangerous when left unchecked. Like other cancers, prostate cancer starts when certain cells begin dividing abnormally and uncontrollably. Instead of following the body's natural cycle of growth, repair, and cell death, these rogue cells multiply rapidly and ignore the body's usual stop signals. Over time, this abnormal growth forms a mass known as a tumor. In its early stages, the tumor may remain confined within the prostate gland. But in more aggressive cases, cancer cells can break away, enter the bloodstream or lymphatic system, and spread to other parts of the body, a process known as metastasis. This is when prostate cancer becomes significantly harder to treat. The exact triggers may involve a combination of age, genetics, hormones, and environmental factors. Understanding this process highlights why early detection is not just helpful, it's absolutely critical. What are the risk factors for prostate cancer? Understanding the risk factors for prostate cancer can help you take proactive steps before symptoms ever appear. Age is the strongest predictor. Your risk rises significantly after age 50. In fact, most prostate cancer cases are diagnosed in men over 65. Family history also plays a major role. If your father, brother, or another close male relative has had prostate cancer, your risk is 2 to 3 times higher. Obesity is another key factor. Excess body fat has been linked to more aggressive forms of prostate cancer and higher recurrence rates after treatment. Finally, ethnicity matters. African American men face the highest risk, with 1 in 6 likely to be diagnosed. They also tend to develop the disease at a younger age and with greater severity. If you fall into any of these categories, it's critical to speak with your doctor about screening options. Identifying your risk early allows for closer monitoring and potentially life-saving early action. How to prevent prostate cancer? While there's no guaranteed way to prevent prostate cancer, several lifestyle choices can significantly reduce your risk or help catch the disease early, when it's most treatable. Start with your diet. Focus on whole, plant-based foods, fruits, vegetables, legumes, and whole grains rich in antioxidants and fiber. Avoid processed meats and limit high-fat dairy, which have been linked to higher cancer risk. Skip unproven supplements. There's currently no reliable evidence that vitamins or herbal pills prevent prostate cancer. Exercise regularly. Just 30 minutes of physical activity, 3 to 5 times a week, helps manage weight and reduce inflammation. Maintain a healthy body weight, as obesity is tied to more aggressive disease. Finally, discuss your risk with your doctor. If you're over 50 or over 45 with a family history, ask about PSA testing or other screening tools. Prevention starts with awareness, and small, consistent steps can make a powerful difference in protecting your long-term health. Prostate cancer is one of the most common health threats facing men today, but it doesn't have to be the deadliest. The key is early awareness. We've covered 10 warning signs, some subtle, some more obvious, that your body may already be sending. From changes in urination and persistent pain to unexplained weight loss or discomfort during intimacy, each of these symptoms deserves your full attention. Don't dismiss them as just part of getting older. Prostate cancer is highly treatable when caught early, and the sooner you act, the more options you have. If you're over 50 or have any risk factors, talk to your doctor. Get screened. Ask questions. Share this knowledge with the men in your life. This video isn't meant to cause fear, it's meant to equip you with the power to act early and protect your future. Your health deserves clarity, not confusion, and awareness could be the step that saves your life. If this video helped you, please like, share, and subscribe to stay informed. Comment below if you or someone you know has faced prostate health issues. Your story could help others. Awareness saves lives, and your voice matters. Stay proactive, stay strong, and take charge of your health today.